Simplifying cardiovascular medications, Digoxin, Milrinone, and Nitrates. Hey everyone, welcome back to Nursing and Me, the channel where we simplify tough nursing topics and help you feel confident in your clinical knowledge. In this video, we're focusing on three important cardiovascular medications, Digoxin, Milrinone, and Nitrates. These drugs are crucial in managing conditions like heart failure and angina, and today we'll dig into what they do, how to administer them safely, and what to watch out for. Let's get started. Let's begin with Digoxin, a cardiac glycoside used for systolic heart failure and rate control in atrial fibrillation. Digoxin works by inhibiting the sodium-potassium ATPase pump in cardiac cells, which increases intracellular calcium and leads to a stronger, more forceful heartbeat, known as a positive inotropic effect. At the same time, digoxin slows conduction through the atrioventricular AV node, creating a negative chronotropic effect that reduces the heart rate. Despite its benefits, digoxin has a narrow therapeutic range, usually between 0.5 and 2.0 ng/ml, which means careful monitoring of blood levels is critical. Patients with low potassium levels, hypokalemia, are especially prone to digoxin toxicity, so nurses and providers must watch electrolyte levels closely. Signs of toxicity can include gastrointestinal problems like nausea or vomiting, visual disturbances such as yellow halos, cardiac arrhythmias that can be life-threatening, and neurological symptoms like confusion or dizziness. If you notice any of these signs, it's vital to act quickly because digoxin toxicity can escalate. The antidote for severe digoxin toxicity is digoxin immune Fab, sometimes referred to as DigiFab or Digibind, which binds to the digoxin and helps remove it from circulation. When administering digoxin, always remember to check the patient's apical pulse for a full minute and hold the dose if it is under 60 beats per minute, then notify the provider. Patient education should emphasize the importance of consistent follow-up for blood tests, awareness of toxicity symptoms, and the critical role of reporting any new or worsening signs, particularly changes in vision or heart rhythm. Now let's discuss Milrinone, a phosphodiesterase 3 (PDE3) inhibitor, often referred to by its brand name Primacor. This drug is typically administered intravenously and is used for patients with acute decompensated heart failure who need more immediate support. By inhibiting the PDE3 enzyme in cardiac and vascular smooth muscle, Milrinone increases cyclic adenosine monophosphate (CAMP) levels, boosting the force of heart contractions, positive inotropy, and promoting vasodilation. As a result, the heart pumps more effectively and experiences less resistance, improving overall cardiac output. However, because Milrinone strongly enhances cardiac contractility, it can also lead to serious arrhythmias. It may cause hypotension due to vasodilation, and patients sometimes experience chest pain or headaches. When administering Milrinone, continuous ECG monitoring is essential to detect dangerous dysrhythmias, and blood pressure should be tracked to catch any sudden drops. Renal function is another consideration, as Milrinone is excreted through the kidneys and may accumulate if renal clearance is compromised. In most cases, this medication is reserved for short-term hospital use, often in critical care settings where close patient monitoring is standard. The final category we'll look at is nitrates, which include nitroglycerin and isosorbide, such as isosorbide mononitrate or dinitrate. These medications are primarily used to manage angina by relaxing vascular smooth muscle and causing vasodilation. Since venous dilation is more pronounced, the heart's preload decreases, reducing the volume it must handle with each beat. This lowered preload helps the heart require less oxygen, easing the pain associated with angina. For sudden chest pain, sublingual nitroglycerin tablets or sprays are the mainstay, and patients are advised to take one dose at the onset of pain and wait 5 minutes before taking another if there's no improvement, for a total of 3 doses. They should also call for emergency assistance if the first dose does not alleviate the pain. Longer-acting forms like transdermal patches or isosorbide preparations help prevent recurrent angina episodes, although patients must ensure they have a nitrate-free window to avoid developing tolerance. Common side effects include headaches, dizziness, and orthostatic hypotension, and there can be reflex tachycardia as the body tries to compensate for the vasodilation. It's also crucial for patients to avoid combining nitrates with erectile dysfunction medications such as sildenafil, because this combination can cause a dangerous drop in blood pressure. By educating patients on proper timing, dosage, and potential interactions, you can help them safely manage angina and reduce cardiovascular risks. That's our deep dive into digoxin, milrinone, and nitrates, 3 vital medication groups in cardiovascular care. Let's revise the key points I've discussed. Digoxin strengthens and slows the heartbeat, but comes with a narrow therapeutic range that requires close monitoring and an awareness of its antidote, digoxin immune Fab. Milrinone offers powerful cardiac support through IV administration in acute heart failure scenarios, but it demands vigilant ECG and blood pressure monitoring. Nitrates remain the go-to for angina relief, ensuring lower cardiac workload and faster symptom control, although they do come with important safety considerations. If this video helped clarify any questions you had about these medications, please give it a thumbs up and subscribe to Nursing in Me. Thanks for watching, and until next time, keep learning, stay safe, and remember, you've got the power to conquer every nursing challenge.